Hi everyone, my name is Alina and I'm a student at the University of New England. Today I'm going to talk about the connection between magnesium and heart disease. So what is magnesium? Magnesium is an essential mineral. It is the fourth abundant mineral in the body. It's found in the bones, muscles, and in the blood. It is absorbed mostly in the intestines and excreted in the urination. So about 53% is in the bones. About 27% of magnesium is in the muscles. 19% is in soft tissue, and only 1% is in the blood. Magnesium is involved in more than 300 reactions in the body. Some of them are maintenance of normal heartbeat, keep blood pressure normal, muscle and nerve function. It is also regulates calcium, potassium, and sodium, and it is essential for cellular health. And all these functions are critical to the cardiovascular system. Low magnesium, the causes are decreased intake, so more processed food and less fresh foods. So magnesium is usually found in fresh foods, and like spinach, avocado, bananas, also lentils, quinoa. But when you eat more processed food, there's hardly any nutrients in it. So that's what there's lack of magnesium. Another reason is decreased absorption due to medications or just being elderly. So some of the medications decrease absorption, especially in elderly people. And there's another reason too. There's also low magnesium in the soil. So the role in magnesium. Magnesium is required for proper electrical signaling within the heart muscle and helps stabilize a normal rhythm. Deficiency in magnesium has been shown to increase arterial stiffness, increasing blood pressure, and workload on the muscles. Low magnesium impacts cardiovascular health and mortality. Studies have been shown that increased intake of magnesium can reduce cardio mortality by 50%. So what are the signs and symptoms? Some of them are loss of appetite, fatigue, poor memory, confusion, nausea, and vomiting. Low levels of magnesium can also cause weakness, muscle spasm, and sudden death. So what do the studies tell us? One of them is made by Andrea Rosnoff, PhD, Director of Research in the Center for Magnesium Education in Hawaii. Studied the magnesium connection to heart disease for many years, and her findings were that CVD is linked to low magnesium levels. Dr. Rosnoff says that many doctors usually do not check magnesium levels in heart disease patients, and after conducting many studies about magnesium and heart disease with her patients, she came to a conclusion that giving these patients the right amount of magnesium, it can help correct and prevent cardiovascular disease. Another study, it's in a systematic review for 4 studies, including more than 27,000 cardiovascular patients testing for low magnesium levels in CVD. Hypomagnesia was associated with increased risk of CVD death in elderly people. The conclusion is that current evidence support the importance of dietary magnesium for lowering CVD and risk of possible death. A different study based on genetics provided evidence that magnesium levels are associated with risk of cardiac disease. More studies said a different study checked the influence of circulating dietary magnesium for the risk of CVD. The results were that circulating magnesium was associated with 30% lower risk of CVD. The conclusion was that dietary magnesium is associated with CVD risk and prevention of heart failure, with support of clinical trials to evaluate how much magnesium is needed for prevention of CVD and heart failure. The recommendations were to increase magnesium-rich foods and also supplements. Many studies were conducted in the US, Britain, Spain, and other regions of the world with thousands of heart disease patients, showed there is a strong connection between low magnesium levels and heart disease. All these studies and trials showed when giving supplements to CVD patients, it improves their health and can prevent death due to cardio disease and heart failure. So the methods of my proposed study is taking 100 cardiovascular patients ages 50 to 75 years in Cedars-Sinai Medical Center based in Los Angeles. They're going to be men and women, and they will participate in the screening for magnesium levels study. Half of the patients have CAD, which is coronary artery disease, and half of them are going to have a history of heart failure. So CAD is coronary artery disease. It's the most common form of cardiovascular disease, which is a hardening or narrowing of the arteries, and half will have history of heart failure, which occurs when stiffness of the heart prevents the organ from pumping blood through the body. The participants will get their magnesium levels checked and will be giving magnesium supplements to take daily for a whole year. So the recommendations are 320 milligrams for women and 400 milligrams for men daily. All participants will require to fill up a questionnaire about their health, medications, what kind of food they're eating, employment, level of exercise, and how is their energy level. The participant will have a blood test plus special magnesium screening to check their magnesium level. They will be giving the supplements, and they're gonna have the questionnaire before and the test before the study, and then a year later after the study is done. According to the Centers of Disease and Control and Prevention, which is the CDC report, heart disease is still the #1 cause of death in the United States. In the year 2019, there were almost 1 million deaths from CVD, more than all kinds of cancers combined, which is the second cause of death in the United States. Many studies that were conducted in different countries showed a strong connection between heart disease and low magnesium levels. Many tests are being conducted for CVD, but magnesium levels in an RBC test is usually not checked. So, anticipated results. Based on current literature review and anticipated findings, the expected results are going to be that daily magnesium supplements will have a positive effect on the health of CVD patients. It can improve their health and prevent premature death due to cardiovascular disease and heart failure. The patient's lipid panel will improve. There will be less hardening and blockage of the arteries. The patients will have more energy, and some of the medications might be reduced due to their improved physical health. Magnesium is a mineral needed in the body in small amounts, but it has many important functions in the body. Magnesium is the gatekeeper for calcium being allowed into muscle cells to cause contractions. The magnesium ushers the calcium out of the cell. Without magnesium, calcium floods the cells, leads to hypercontraction of the muscle cells, which can cause a heart attack. Many CVD patients have low magnesium levels due to medications, hospitalizations, and being elderly. Magnesium supplements and increased food intake with high magnesium levels will improve health and reduce the death rates of CVD patients. And that concludes my presentation. Thank you for watching.